Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Sarah Anderson. In this episode, we focus on how to monitor for new HIV infections in people taking long-acting cabotegravir for PrEP. To explain more, I'm joined by Dr. Darcy Wooten from the University of California, San Diego. For more information about Dr. Wooten and this program, and to follow along with the slides, please visit the links in the show notes for this episode. Now, Dr. Wooten, why is it important that we talk today about monitoring for new HIV infections in people receiving long-acting PrEP?
This is important to highlight because this was a pretty significant change in the guidelines that came out just over a year or so ago, but hasn't been necessarily widely adopted. So important to kind of highlight. I think the keys here are that when we do HIV testing for any type of PrEP, the guidelines now recommend not only an antigen antibody test, but also an HIV viral load. And then this just highlights the point in terms of the updated guidelines for why we're recommending not only an antigen antibody test to monitor for new HIV infection, but also an HIV viral load. And the rationale for this is that, especially with long-acting CAB as PrEP, you really do have a delay in being able to detect a new HIV infection because of that long half-life. So baseline infections were delayed. There was a delay in diagnosis of 62 days with cabotegravir, and incident infections were delayed 98 days. And there were even 5 patients who actually received a subsequent dose of cabotegravir when they had already acquired HIV. It just hadn't been detected at that point. And so, of course, if you're giving monotherapy with a single dose of cabotegravir, that's going to increase your risk for developing INSTI resistance. And so, given this concern and this delay in being able to detect new HIV infection, the guidelines changed to including recommending HIV viral loads when you're monitoring for new HIV infections. As we know, a viral load could pick up a new infection sooner than an antigen antibody test can. And then just reviewing the key points when a patient on long-acting CAB for PrEP develops HIV infection. And this is exceedingly rare. I just want to point that out. But it is crucial, even though it is a very rare event, it is crucial to understand how to manage both antiretroviral therapy and genotype resistance testing in these patients. Of course, you want to get routine baseline labs that you would get in any new diagnosis of HIV and link people to an HIV care provider. But the key points are really that you want to, of course, check for resistance, including integrase resistance and getting an integrase genotype. And then also, if you don't have the results of the genotype back and you want to start the patient on antiretroviral therapy that day, because we know about the benefits of rapid start, you should use, and the guidelines recommend using a boosted protease inhibitor regimen and not an integrase regimen like first-line regimens that we would normally use because of this concern for integrase resistance.
Thank you very much to Dr. Wooten, and thank you to our listeners for joining in. As a reminder, to view the full Contemporary HIV Treatment and Prevention 2023 program on the Clinical Care Options website and to access the slide set for implementing long-acting ART in clinical practice, click on the links in the show notes for this episode. And please be sure to check back regularly for more episodes on important infectious disease topics. Thank you.